Per the Centers for Disease Control, also known as the US CDC, information for travelers returning from Ebola affected areas. Friday, May 29th, 2026. What to know? CDC temporarily restricted entry for certain travelers who are recently in DRC, Uganda, or South Sudan. As of Friday, May 22nd, 2026, U.S. citizens and nationals may still enter but will undergo enhanced public health screening. Travelers should monitor for Ebola symptoms for 21 days after leaving affected countries. Anyone who develops symptoms should avoid travel and contact public health authorities immediately. As part of this response, CDC will conduct public health screening for individuals arriving from areas affected by Ebola outbreaks in the region. Support state and local health departments in traveler monitoring efforts. Coordinate with airlines, international partners, and port of entry officials to identify and manage travelers who have been exposed to Ebola virus. Enhanced port health protection, response activities, contact tracing, laboratory testing capacity, and hospital readiness nationwide. Continued deployment of CDC personnel to support outbreak containment efforts in affected regions. At this time, CDC assesses the immediate risk to the general U.S. public as low, but we will continue to evaluate the evolving situation and may adjust public health measures as additional information becomes available. If you traveled to an affected country, you are encouraged to monitor CDC travel health notices and seek medical attention immediately if you develop symptoms consistent with Ebola, including fever, weakness, vomiting, diarrhea, and unexplained bleeding within 21 days of travel to affected areas. Why is the CDC taking these actions? CDC issued emergency public health measures to help reduce the risk of Ebola spreading to the United States during the current outbreak response. Ebola is a serious viral disease that spreads through direct contact with infected bodily fluids and can be fatal. Because people exposed to Ebola may travel before symptoms begin, CDC is implementing layered prevention measures. Who is prohibited from entering the United States? Under a CDC order effective May 18, 2026, certain non-citizens who were in DRC, South Sudan, or Uganda within the past 21 days are temporarily prohibited from entering the United States. As of May 2026, HHS has issued an interim final rule revising the authority under 42 CFR Part 71.40, which temporarily limits the entry of specific people into the United States to help stop the spread of dangerous diseases. The revised rule now applies the ability to suspend introduction into the United States to U.S. lawful permanent resident green card holders. Given the current Ebola outbreak, this means lawful permanent residents who have been in the DRC, Uganda, or South Sudan within the last 21 days are prevented from entering the United States. How long will this last? The suspension is temporary and is currently set to remain in effect for 30 days while CDC completes a public health risk assessment and coordinates mitigation measures with partner agencies. If I am not subject to their entry restrictions, what happens after I arrive in the United States? Travelers permitted to enter the United States who have recently been in DRC, South Sudan, or Uganda will undergo enhanced public health entry screening. Will my flight change? Possibly. These travelers will have their air travel rerouted to arrive at select airports. Airlines will work with affected travelers to rebook flights. Travelers will have their air travel rerouted to arrive at Washington Dulles International Airport, starting Wednesday, May 20th after 11:59 p.m. Eastern Daylight Time. Hartsfield-Jackson Atlanta International Airport, starting May 22nd, 2026 after 11:59 p.m. Eastern Daylight Time. George Bush Intercontinental Airport, starting Tuesday, May 26, 2026 after 11:59 p.m. Eastern Daylight Time. John F. Kennedy International Airport, starting Thursday, May 28, 2026 after 11:59 p.m. Eastern Daylight Time. What happens during public health entry screening? Travelers may be escorted to a designated screening area. Complete a brief questionnaire about travel history and symptoms. Have their temperature checked using non-contact thermometers. Be observed for signs of illness by CDC staff. CDC may also collect contact information for follow-up by state or local public health. CDC may also collect contact information for follow-up by state or local public health authorities if needed. Some travelers may have an additional public health assessment if they have been in certain situations. What if I do not have symptoms? Travelers without symptoms will receive information about monitoring their health for 21 days after leaving the affected countries. Most travelers without symptoms will continue their final destination after public health entry screening. What if I have symptoms during screening? Travelers with fever or other symptoms that could be Ebola will receive additional evaluation by a CDC public health officer. If the assessment shows that a traveler may be sick with Ebola, the traveler will be transferred to a hospital for further medical evaluation and isolation. Will CDC contact me after I arrive? CDC will use automated text messages to remind travelers arriving from DRC, South Sudan, or Uganda to monitor their health and actions to take if symptoms develop. Traveler contact information will also be shared with state and local health departments for additional follow-up and support. Does screening detect every Ebola case? No. Public health entry screening cannot identify travelers who are infected but not yet showing symptoms. Ebola symptoms can develop up to 21 days after exposure. Screening is one part of a broader, layered public health approach that also includes exit screening overseas, airline illness reporting, and public health monitoring after arrival. Who determines if I need to be redirected for public health entry screening? The United States Department of Homeland Security, DHS, determines whether a traveler needs to be redirected for public health entry screening. If my ticket is already booked to arrive at one of the airports where public health entry screening is happening, will I be redirected to a different airport? No. Passengers whose travel was already booked to land at one of the airports designated for public health screening will not be redirected to another airport. Does transiting through these countries count? What if my plane stopped in DRC, Uganda, or South Sudan, but I never got off the plane and remained on board? DHS will determine if someone who transits through one of the affected countries or who remains on board when their plane lands is in one of those countries. Who remains on board when their plane lands in one of those countries is considered to have been in DRC, Uganda, or South Sudan for the purpose of redirection to a designated U.S. airport. If they determine you departed from or were otherwise present in one of those countries, your ticket will automatically be rebooked by your airline, or your airline will reach out to you to update your itinerary so that you land at one of the airports where public health entry screening is being conducted. Will I be reimbursed for the expenses I've incurred due to the redirection? CDC does not reimburse travelers for expenses incurred as a result of redirection. This includes missed flights or other costs related to redirected travel. These restrictions are in place to facilitate public health entry screening to reduce the risk of Ebola spreading into the United States during the current outbreak. Refunds, credits, and other travel-related accommodations are determined by individual airlines, travel providers and insurance companies in accordance with their own policies. Some companies may base their policies on CDC travel recommendations or requirements. In some cases, trip cancellation insurance can protect your financial investment. In some cases, trip cancellation insurance can protect your financial investment if you need to change your itinerary because of an international infectious disease outbreak. Visit CDC's Traveler Health website if you'd like to learn more about travel insurance, including trip cancellation insurance. CDC notes that this website Visit CDC's Traveler Health website if you'd like to learn more about travel insurance, including trip cancellation insurance. CDC notes that this website regarding travel insurance is provided solely for informational purposes and does not constitute endorsement, actual or applied, of any specific provider or organization or consumer advice.